If there was one thing you wish people knew, what would be that one thing?
Doctors and probably want to be working for them, but the entire healthcare system is not working for them. So what they need to understand is they have to protect themselves in the exam room today, and they have to protect themselves and their freedom in this country. And so, take a look at the information on our website, which is meant to help you protect yourself against coercion in the exam room and to give you truth and protect yourself against coercion in Medicare decisions, but also to stop the Real ID. We need everybody in this country to understand what Real ID is and to put their best foot forward to stop it and to tell people what it really is.
Welcome to the show. Today we have Twila Brase, and she is a nurse and the president and co-founder of Citizens Council for Health Freedom. Now, I'm really bad about talking about everyone's credentials. And she has so many, we could be here all day long, but just a couple that I thought were really cool is that she was recognized by Modern Healthcare as one of the most powerful people in healthcare in 2009 and Minnesota Physician 100 Most Influential Healthcare Leaders in 2020. So I thought that was really cool. There's so many more things, and obviously these don't define you, but I think it's pretty cool to mention that. So welcome to the show.
Yeah, well, I'm just really glad to be here. I'm excited for it.
Yeah, we've been planning this for a while. And first, I just want to ask, okay, so can you tell us just a little bit about what Citizens Council for Health Freedom is?
Yeah, so we've been around for basically almost 28 years, and our mission is to protect patient and doctor freedom, which means that's the freedom for the patient and the doctor to work together in privacy and confidentiality for the benefit of the patient and not for the benefit of anybody else. And so like I said, our motto is protecting patient and doctor freedom, and we've been doing it since 1998.
Well, and that's what's so interesting. So when I just see your title, like health freedom, I'm all for health freedom. I'm for informed consent. We should be able to decide what we put in our body, all that good stuff.
Mm-hmm.
And then I see that you want to talk about data. And I'm like, wait, what? This isn't a tech conversation. But as I'm reading through your information, I'm like, actually, this has everything to do with health freedom. So I definitely just want to jump into this. And just for an FYI, why we're talking about this, I went to school for marketing, and specifically, I wanted to go into market research. So looking at survey data, focus groups, all the good stuff. And I mean, data is so important. In business, data is king. So when you want to talk about data, especially when Doge came in, it blew up. Everyone was like, oh my gosh, they're going to come in, they're going to have access to all of our data. And that's their goal. It's not actually to cut spending. And at the time, from someone who understands the importance of data, I was like, okay, but you got to take the good with the bad. They'll have access to stuff, but if the end goal is to cut spending, then that's great. And I always give this example. And after I give this, I'll shut up and let you talk. So I always give this example. So I have Under Armour running shoes, and they're Bluetooth. So you can leave your phone at home or take it with you, it doesn't matter. And it tracks your run, tracks your stride, how fast you're going, all that. And actually in your headphones and stuff, it will tell you, hey, you need to pick up the pace, you need to slow down. And it gives you some just really good tips for running. But obviously that's data that they're collecting on us. What they also do with it is they make better shoes. So they have found by using this technology, okay, that women need more ankle support than men. So they've been able to make better shoes. So that's where we have to take the good with the bad. Yes, they are tracking literally where I run. And that's, kind of an invasion of privacy. But at what expense to make better shoes? And now they're the only shoes that I wear when I work out. So that's why I've been so hands off with this concern, this topic, because I see that it's important. And again, got to take the good with the bad. But you are here to scream, no, we need to hit the brakes here because we're going too fast. And there's been so many things just even this past year that have happened that they're really ramping up, and it seems like big tech is taking over. So, after all that, let's get into some stuff. One of the
Okay.
first things you have talked about is real ID. Tell me everything. Tell me why this matters. What is really the point of real
Mhm.
ID in the first place? Like, is there any good to it? Just tell me everything.
Wow. So, okay, I think, for people to understand really what this is, I'm just going to lay out a few facts because people think that the real ID is they just think it's their driver's license. And
Mhm.
they think it's their driver's license with a star, right? And so that is so not true. Essentially, the state DMVs have been hijacked by the federal government. They have agreed to the coercion placed on them by the federal government, and they are now issuing federal IDs under federal control. And it is masterful and clever idea to make them look like the state licenses and the state IDs, and just put this little star there to convince everybody that nothing had changed, but everything has changed because who controls is really important. And today you have state driver's licenses under state control if you haven't got a federal ID. But if you have moved to the federal ID, to the real ID, the state driver's license with a star, then you are under federal control. And by federal control, I mean that, think of all the things that you use your ID for. You pull it out for this, you pull it out for that, you pull it out for this, right? So that everything that you pull it out for, whether or not you could access it, whether or not you could travel to that place, whether or not you could do that transaction, could be under federal control as soon as it gets digitized. And the DMVs, through an organization called the American Association of Motor Vehicle Administrators, the short way of thinking about this is all the state DMVs. It's like their organization of the state DMVs, right? So they testified on December 5th, 2023, that their plan is to digitize the Real ID, put it on your phone, and have remote access to it. So that would mean that every time you pull it out, one, you ping a government database, and two, whether or not it is live and able to be used is under federal control because it is now a federal ID. It is not a state ID, and it's not under state control. So this is a usurpation of states' rights by the federal government. And when this first happened in 2005, this language, the Real ID Act, was, well, let's just say in the middle of the night, it was attached to a must-pass national defense spending bill. So it never went through the U.S. Senate the typical way. You'd bring it to different committees, there'd be different votes. That never happened. It was never part of a conference committee. It was added to the bill and then taken to the floor of the U.S. Senate on a must-pass basis, and everybody was told to vote on it.
Wow.
And so this federalizing of identification, this federalizing of driving credentials, this federalizing of everything that you could possibly do with an identification card all happened completely outside the typical way that the public would get a better idea. There would be more debate and, on the floor and in the House, and the news would have, grabbed hold of it and said, whoa, there's this big debate happening, but that didn't happen. So then the states, after learning about this, so it passes in 2005. In 2007, the Department of Homeland Security puts out a proposed rule. And I think that's when the states got wind of this. And then 2008, they put out a final rule, and they told states to do this, like completely against a states' rights in the 10th Amendment.
Yeah.
And a bunch of the states said, no, we are not going to do that. And so they wrote bills and they passed bills that prohibited any conformity with the Federal Real ID Act, or they passed resolutions that completely opposed it. And there it sat from basically 2009, when almost 30 states engaged in some way to oppose it, until late 2015. And that was when President Obama herald it from the rooftops that you will not be able to fly in 2016 if you don't have a real ID. And that's really the first time I think that the national media had ever heard this. And so they picked it up and they blasted it across the country. People got afraid that they wouldn't be able to fly. They wouldn't be able to go on their vacations, see their grandchildren, do the work that they needed to do in a different state. And they really contacted state legislators and basically said, fix this. Now, unlike what the state legislators did, 9, 10, 11 years before that, where they said, yeah, no, we're not going to do this. We will not bow. We will not bend. The state legislators, because now it had become such a public issue, they really bowed over the next 3 years and complied. And so now what we have is all the states offer this real ID. Most of the states don't tell you what it is. And they just let you think that it's the only thing that you could possibly want. So why would they tell you about the fact that you could have a standard state driver's license? So they just don't tell you. They just give you the federal ID, or they tell you you can't have anything but the real ID. And there are
I
5
remember
states.
when I got married, I just got the star because I was like, I already have all my paperwork to change my last name, so might
Mhm.
as well just get the star. And I always knew it as basically like a land passport to be able to go to Mexico or Canada. And also, we're told you can't fly without it.
Mhm.
So that's why I got it. Um, and I'll say this was before I was political. So
Uh-huh.
so before I did a ton of research into the government. So yeah, I didn't know that it was like a federal ID. And I guess looking back, it's like, why? Like, why do we need that to fly? So like what does the government say today? Like why do they say that this is important?
Oh, well, first of all, you don't need it to fly. So I just want to let your listeners know that you don't need it to fly. There are 16 different IDs to fly. And if you ever lose your ID, if every one of us had a real ID, there's always a way to get on the plane, just like there always has been. When someone steals it or when you've lost it. And it's interesting because I lost mine once at the airport before I got on the plane. So I know the process. And the process is you go to a little table with a phone with a TSA agent. He picks up the phone, he calls in and he starts asking questions like, what was your first email address? What was the
Wow.
color of your first car? What was your first address in whatever city that it was? I mean, that's the kind of thing that they ask. And then they do a search and then they let you on the plane. They've always had this procedure,
I didn't
and
know
they
that.
will always have this procedure. So you can always get on the plane even without any kind of ID whatsoever.
Wow.
Okay, but what they say is that they need it for increasing security and on the plane because of the terrorists from 9/11. But the interesting thing about that is all the terrorists had valid licenses and valid passports. They were completely valid. And and then the other thing that they will say is it's a way to keep illegals out of the country. But there are 19 states that give driver's licenses to illegals. This is not going to keep illegals out of the country, and those illegals can drive with those licenses. And so illegals probably wouldn't want to fly anyway. But I think it's more important what they aren't telling the American public. So one of the requirements for real ID is that there be a biometric photo. But the rule also says it can be additional biometrics might be added in the future. Now, a biometric photo is a digital photo. It's not just like the photos you and I take on our phones. It's actually digital, and there are special cameras to take those digital photos.
Oh.
And they require a biometric, and starting with the face. So they're grabbing your facial geometry. They want 50 points between your cheekbones and your eyes. They want 50 points that they are grabbing. And some of us think after they've got the 50 points, they don't actually need your photo. They've just got the points, right? So that they can line it up. And this is for facial recognition technology. So what they've essentially said is we, the government, have the right to collect the coordinates of your body and catalog them for our control, for implementing facial technology, facial recognition technology across this country, being able to tag you and track you wherever you go. And the other thing they're not telling you is it won't stop with flight. So that's how they're getting people to conform, comply, submit because of flight. But what happens if they say you have to have real ID for access to a doctor or to a hospital? So today there's 44% of all IDs that are not real ID compliant. People have chosen not to get it. Some people have figured out what this is. They figured out it's a big control system, a surveillance and control system out of the federal government. They're not going to get it. Other people just don't want to deal with the paperwork. So anyway, they want everybody. So they want 0%. But right now they have 44%, and they're putting on the pressure to try to get you to get the real ID. How would they actually do that really quickly? They would simply say that a new official purpose for the real ID is access to medical care. And their rationale would be that about 47% of all medical expenses are funded by government, state, local, federal, right? And what you need to understand is that the law itself says this about official purposes. It says the official purposes of the real ID are to access federal buildings, to access nuclear facilities, and to access commercial flight, and any other purposes that the Secretary of Homeland Security shall determine. Any other. So the Secretary, all by herself or himself, depending on when this would happen, right, could add things like access to medical care. We're a health freedom organization, and we see this. We see that it could probably be used to get the entire country into this surveillance system.
Well, and that's why, like, you talk about this, that's the connection here. So
Right.
you are promoting health freedom, but we're
Right.
talking about real ID because it could end up that way, that we
Right.
need this real ID just to get basic care.
Right. Yes, and a Republican in California wants to require the real ID to vote. The last thing that a state should do is to put the federal government in control of their voting in the state and who can vote and who cannot. And so it could be like gun purchases. It could be going to college. It could be paying your taxes. It could be renting a vehicle or buying a home. All of this could suddenly require, for security purposes, a real ID. And this is federal control, like I said, over all parts of your life. So every transaction, every place that you might want to travel, every access point that you might want to get to, suddenly the federal government is in control of it. And that's why we are leading the charge, to stop real ID in this country. And we have had already some successes. We know people all over the country are trying to switch back to their state driver's license, and some of them with more success and some of them with less. In California, it's easy peasy. That's what somebody told us. In Minnesota, where our organization is located, well, we fought against it for 2 years, and so our law is better than any other law. So if they would add access to healthcare, our law goes away. So, that was something that we put in our law, but that's not in other people's law in other states.
So you're saying if someone like me has a star, I can go and actually tell them I don't want the star anymore.
Yeah. You can tell them you want a standard state driver's license, and they know it's a federal ID because somebody that got one in some other state, the DMV agents looked at her and said, I don't want to be nosy or anything, but why do you want to go back to a standard driver's license? She goes, she just kind of, made it very vague. And she said, so the DMV agent said, so you don't want the federal ID?
Cat's out of the bag now. Oh, man. Wow. Okay. So, yeah.
I think I should, if I could, I would like to just tell people where to go for more information.
Yeah, for
at
sure.
this point, and to engage. So go to refuserealid.org, refuserealid.org. And we've got all sorts of one-pagers, even like how to switch back to a driver's license, a one-pager on just 5 things to do, practical guide. We've got all sorts of things like that on that page. And then there's a way,
Nice.
too, to engage and contact your member of Congress or contact the president, because President Trump does need to hear about this.
Yeah, I'm really shocked. This isn't a Republican or Democrat issue
No.
because, this has been going on for years that they've tried to
Mhm.
implement this. And I mean, a lot of people were outraged, rightfully so, when this administration was like, okay, it's happening. You can't fly anymore without it, all that good stuff. And, I feel like at first this can sound conspiratorial, but we have seen other countries use this. I mean,
Right.
even in Canada, what was it during COVID? They said if you don't get vaccinated or you don't wear your mask, we're gonna shut off your bank
Mhm.
accounts. And
Right.
literally, like they were
They
doing that.
did.
You couldn't even
Mhm.
access your bank account
Right.
if you didn't follow through. And then I don't know, do you know anything about, because I've heard recently about Britain doing this? Is it
Mhm.
mandated now? Like, what do you know about that?
Yeah, so there is a date. I can't remember what the date is, but the head of England said you will not be able to work if you refuse the digital ID. Now, I just heard a day or so ago that maybe there's some thought about withdrawing this because there are people who are in the street. There are thousands of people in the street and they're protesting and they've got signs and they can see this future. They don't want this future. Right.
Hmm.
And so, it's possible that they have made enough of a stir that something will be delayed or stopped. But the problem here in this country is people don't realize that the plan here is to digitize the real ID and it's a federal ID. And so nobody is really protesting it. And people say to me, well, it's a done deal. And I say, it can't be a done deal unless you don't want freedom in this country. It can't be a
Hmm.
done deal. And we will not let it be a done deal. And we certainly hope that your audience will engage on this issue. In good news, Senator Rand Paul, who is chairman of the Homeland Security in the Senate,
Hmm.
uh, has just released a bill to repeal Real ID.
Nice.
Now you need to have something over on the House side, and it needs to work its way through. But he has now stood up and said no to Real ID, and he just tweeted about it 2 days ago. So
Nice.
I am hopeful, and we are asking people to ask him to hold a public hearing on this. Let's get out the facts about this. Let's talk about where this is really going, because it's going to where England is even closer to going. And it's really going to
Exactly.
the
Like,
Chinese social credit system. That all
yeah,
happened through
and
the
that's
phone,
the
right?
thing. Like, this isn't a conspiracy because other countries have done this.
Hmm.
Like in China, like if you jaywalk, they know and
They
they
do,
will ticket you. They will take funds out of your account and everything
right?
because they have cameras everywhere that track everyone.
Yeah.
And we could end up like that. And if you think like, oh, it's not a big deal, once a government starts to infringe on our rights, there's no stopping them. And we saw this during COVID. I mean, they censored us so bad. And once they took that freedom of speech away, everything else started to fall too.
Right.
You couldn't sue anyone that had anything to do with a COVID vaccine. And like, so
Hmm.
that was infringing on our rights and just so many things. So if we fall now, what's next after that?
Hmm.
So that's why this
Hmm.
is so important. And I always encourage people, if you haven't already, you need to read our Constitution and the Bill of Rights. You
Very
you
good.
need to read our Constitution. You can't protect rights you don't even know we have. So
Hmm.
I didn't even know the power of states' rights a
Hmm.
few years ago until I really learned about our Constitution and the founding fathers, what they envisioned for our country. And
Right.
states' rights are so important. So we need to protect that. And that's exactly what you're saying. Like, this real ID is really giving the federal government more control than they should. States should be able to run certain things, and our DMVs are one of them.
Hmm.
Um, Anything else you want to talk about on this topic before we head to the next one?
I guess the only thing is, I would like to encourage people to go online, see the different things that they need to know about Real ID that do not come from the government. Even I would like to ask them to take our social media where we have clips of interviews, clips of Rand Paul's tweet, clips of his bill, clips of all sorts of things. Really, the American people have been deceived about Real ID. And they need to understand where this is going so they can rise up, just like England has risen up to say, we don't want this kind of totalitarian system. And I know that on another podcast, that was something that the host used, was that word. And I'm like, that is exactly where this goes. That's what China is dealing with. Everything happened by their phone because it was digitized and biometrically controlled. And that is what's going on with Real ID. That's where it's going. I think the last thing is a quote from 2007 by the head of the Department of Homeland Security. So that was just 2 years after Real ID passed.
Mm-hmm.
And he said, and I'm paraphrasing, he said, we are gradually biometrifying the global population. And the fact of the matter is, Real ID will become a vax passport. It will probably become a link into the global identification system. It'll probably become the link to your medical records, all of these things, under their control. And so I'm asking your audience, please don't let this happen and help us fight this by, standing up, telling people, telling your legislator to join with the legislators around the country who are helping us by writing state legislation to extract themselves from Real ID. So I think there's lots of things people can do, and I really think it's the public that will defeat Real ID. So start switching back, or totally refusing, and then telling everybody about this. Tell them, pull your ID out of your pocket and let me see if there's something I need to tell you about that ID. Really, we just have to tell everybody.
Yeah. And when you're talking about like digitalizing the records,
Yeah.
it makes me think of just recently HHS partnered with big tech companies
Yeah.
to to make digital records of all of our medical records. So when you go
Mhm.
to the doctor, you can just hit a button on your phone and say, I give them permission to my records. They
Right.
say that this is good because we will have our records at the palm of our hand, and we can decide who we give it to and stuff. But when that news came out, I'm like, why are we partnering with like Apple and all of the big tech companies? I don't
Uh-huh.
like that. And funny enough, I actually looked into it because I noticed the option came up in my health app on my iPhone and it said digital medical records. And I said, oh, that was fast after HHS announced that. But I actually found an article that they added that months before HHS actually partnered with them.
Mm.
Um, so what do you know about this? Is this I mean, it sounds bad. It sounds bad to me, but is this like along the same line of the Real ID?
Well, it's different, but digitizing is digitizing. And when the government's digitizing or working to digitize, it can all more easily just be put together. And so, what you're talking about is the health tech ecosystem that was announced, I think, in July. And the health tech ecosystem, when they talk about it in their official documents, like the regulations that they put out, the rule that they put, the final rule that they put out, so the proposed regulations and then the final rule, when they talk about it, they talk about a variety of things. They talk about CMS, CMS alignments. What do they call that? CMS aligned network. So they are pulling together all these data companies and asking them to align with the federal government and become a CMS aligned network. And so if you look at that list, it's a huge list. I believe it includes Amazon, it includes companies you've never heard of, companies you have heard of. And all of them, the government wants in a network for sharing data. Now, they talk about that what they want to do is give you quick access to your information wherever it is and have you get full access to all of your medical records. Well, there's always a convenience rationale to take away your privacy. There always is. And your audience right now, I would bet that your audience believes that HIPAA protects their privacy. And I am here to tell you that HIPAA did the exact opposite. It is what I call one of the hugest and most deliberate deceptions ever foisted on the American people. HIPAA in the industry, and for those who know, is considered a permissive data sharing rule. Permissive, which means that everyone who holds your data, let's just say the doctor, the health plan, think of more, laboratories, x-ray facilities, clinics, everyone who holds your data, they are not forced to share your data. There's only two forced shares. One is with you and one is with the U.S. Department of Health and Human Services. A big share, right?
Mm-hmm.
Okay.
Yeah.
But there's only two forced shares, and that is for HHS to check for compliance with the HIPAA rule. That's what they say, right? But the fact of the matter is it's permissive. So on a permissive basis, anyone who holds your data is permitted to share it broadly without your consent. And in 2010, they put out a rule and they actually listed how many entities that was.
Oh my
And
gosh.
a covered entity is everyone that you expect would have your data. The health plans, the hospitals, the clinics, the labs, right? They call those covered entities. They said there's 702,000 covered entities that have to follow the rule, plus 1.5 million business associates. And amongst those 2.2 million entities, those are not people. Those are entities filled with people. Your data can be shared
Lovely.
with your consent and with your name.
Wow.
Now, researchers can't have your name, and that's a little bit different, but it's still that they still have the ability to gather data from public places, public records, and re-identify you, although they promise that they won't. But I think the big thing to understand is that HIPAA does not protect your data. It has never protected your data. It was never intended to protect your data. So I wrote a book, Big Brother in the Exam Room, The Dangerous Truth About Electronic Health Records. And it talks about HIPAA. There's an entire section on HIPAA to show how did it happen? Who wanted it? Why did they want it? You know, your medical records are more valuable than your social security number.
Mm-hmm.
It has way more value on the street than your social security number. But not only that, it just has enormous value within the industry. So let's just look at the largest health plan in the world, United Health Group. United Health Group has a division. It's called Optum Insights. Optum Insights, all they do is medical data. That's all they do. They analyze it, they slice and dice it, they gather it, they collect it, they sell it, they do all sorts of things, right? And so I believe it was in 2023 where their revenue was $18.9 billion. They're not taking care of any patients there. They're just slicing, dicing, selling, collecting, everything you could think of about data.
Wow.
Yeah.
Wow. See, I always knew HIPAA.
Yeah.
I always knew HIPAA as like employers. Like if you tell your employer, you know, I have this medical thing going on, you know, I need to be off for a week, you give them a doctor's note. They can't share that with anyone. And same with the doctor. It's like talking to a lawyer. Your lawyer can't share what's going on. Your conversations when you talk to your doctor, they can't share conversations. So you're here to tell me that it's all a lie.
It's all a lie. It's all a lie. And they, but I think, you know, some people in your audience are going, well, okay, it's a lie, but I know what's in my medical records and I'm not worried. And no big deal. You know, we don't have privacy anymore. So no big deal. Well, there's two things I'd like to say about that. One, you have no idea what's in your medical record. You have no idea of the comments that have been made about you and your complaints or your family. And what have you said about your family? What have you said about your friends? What have you said about your personal situation, about anything? Because some of that gets written down. And now, as they are moving to what they call AI assistance or ambient listening, where they have recorders in the room to take down every word, plus they have the scribes who are writing every word that you say. Every little word that you say is going into this system where the data can all be shared, right? So don't think that your medical records are like scot-free and couldn't be used against you, or you decide to run for public office. Well, what is actually in there that somebody could find? And what's your family like, and how will it impact your family? Okay. But the other thing is, okay, I was saying that the medical records that they don't know. Oh shoot, I forgot what the other thing is, but it'll probably come to me. The
Oh
reasons why
man.
they're not concerned. They're just not concerned at all
Well,
because they think,
also, Gary Brecka kind of talks about this because he used to be in health insurance and they were able to predict exactly when someone was going to die based on this
yep,
medication and stuff. So I imagine that the health insurance companies are just like watering at the mouth because they want to know all of our data and then they would charge us more for healthcare because we're more high risk, stuff like that, which is probably one of the reasons why healthcare costs are just health insurance costs have gone up so much. Um, yeah. Oh my gosh. Well,
well,
you've scared the crap out of me.
so
Thanks.
so I came up with the second thing, because part of the reason why they wanted access to all of this data is they wanted to control the doctors.
Mm,
So, like, this is part of why I wrote the book, The Dangerous Truth About Electronic Health Records. So, they want to control the doctors. And so, because everything has been digitized, because Obama in 2009, 4 weeks after his inauguration, his first inauguration, he signed the American Recovery and Reinvestment Act. And inside that act was another act called the High Tech Act. And those all stand for something. But what you need to know is it was a mandate for the electronic health record. So before the High Tech Act passed, only 10% of hospitals used electronic health records. Now, because of the High Tech Act, they not only have to buy an electronic health record and use it, they have to buy the government approved, government certified version of the electronic health record, and they have to use it meaningfully. There are 3 federal meaningful use regulations they must follow if they want to be fully paid. And because of this entire thing that I'm telling you about, when you go into the exam room, your doctor, the nurse, whomever, they are focused on clicking the boxes in the
mhm.
chart, right? This is meaningful use. They spend less time with you, lots less time with you, than they spend with the chart so that they can get paid. But this chart is all about reporting data on you. So this is
Yeah.
it's like the entire healthcare system has been taken over, perverted, turned on its head by the businesses. And this is why we say that that the mission of medicine has been taken over by the business of healthcare. And it's
Yeah.
no longer working for the patient. It needs the patient. It needs the doctor. It doesn't have to care about the patient. And it doesn't have to care that it makes the doctor do what the doctor should not do, which is the doctor should spend time with you and be thinking about you and individualizing your treatment to you, right? But now every treatment choice they make is tracked, and they're paid accordingly. And then the electronic health record limits what kind of treatments are even available for them to pick. So
Wow.
that's why the book is called the Electronic Health Records, the dangerous truth about electronic health records, because it really is Big Brother in the exam room.
That's so crazy. I mean, oh, so many thoughts right now. I just had Dr. Urato on my last episode, and we talked
Mm,
about how everything just makes the doctor spend less and less time with the
yeah.
patient. So it's really difficult. So, when, especially me, when I criticize doctors, some of it is not the doctor's fault. A lot of it is health insurance. Which is like my question is it the health insurance companies? Like we say they a lot, like they want
Mhm.
us to digitalize records. They want this. Like Who is they?
That's a really good question. So they is a compilation. And so I name names in the book of people, groups, industries. So really there was a working group for electronic data interchange. It was called WEDI. And WEDI pushed for HIPAA. So there's this compilation, this huge group, and they were government agencies. They were all the healthcare industry, so the hospital systems, the clinic systems, the health plans, the insurers, and then there were all the data industry, right? They were like, if we can just get away from patient consent for the sharing of data, then we can get our hands on all this data and use it to our heart's content, to control the doctors, to do research projects and get research money from the government, to limit the type of care that people even get, to profile patients and figure out, no, not for you. You don't get that treatment because we've decided in our protocols that you, with your configuration of behavior and age and family or no family, single, whatever, that nope, you don't get that. We deny that for you. And so there's just a lot of ways that you can use the data and make money off of it. And so that's what happened with HIPAA, and that's what happened with the electronic health record.
I've been looking at this just this past year. Everyone's screaming that the big tech takeover is happening. Again, like we saw this with Doge coming in, a lot of people started to see this, but you're saying this has been decades that they've been working on this, and it's kind of just coming to a head right now.
Yeah, so the health tech ecosystem is a little interesting. So the one of the things that I haven't said is that the federal government paid for, in every state, they paid for a state health information exchange, or a HIE, health information exchange, HIE. So the state HIE, but they also paid to create a federal health information exchange. And that's really where the data exchange is happening. And all of your listeners can go to ehealthexchange.org. And the federal government and this exchange, essentially, for those who want to come in and participate and get the data from all over the country, wherever their patients go, they just get a software and they hook into the eHealth Exchange. So if you're in Washington State and your home is in Florida, and Washington State, you're seeing a doctor, they come into your room and they say something about, I see your medications are X, Y, and Z. And you're like, wait, I didn't tell you anything about my medications. So they probably tapped into the eHealth Exchange, which then pointed them to the open portals in Florida, and they pulled your medication records out of there. So within this system, it's very hard for you to get a second opinion, an unbiased opinion, because they're getting all of your data from everywhere without your consent. Now, some states like Minnesota, we actually, because we do a lot at the legislature, we got this little tiny box that had to be in the consent form where you could agree to be part of the HIE or not. Nice. And if you don't click it, you're not part of the state HIE, which is hooked into the federal HIE. But if that healthcare system is independently hooked in there, then your data is not made available to the eHealth Exchange. And so this has been going on for a very long time. And so when I look at the health tech ecosystem, and I think, what are they doing here? Because they got the eHealth Exchange. And I think that they're having some difficulties with exchange of data, and because there are state laws that limit data, like Minnesota has a great state law, and there are other state laws that just are limiting data for the health information exchanges, the HIEs. They want to universalize it in another way. Plus, they want all the data on your apps. That's another really big thing in here. So all of these health tech or just technology enterprises that are part of their CMS aligned network, that are part of this big network that they're creating in this ecosystem, they want it all to be interoperable, which means fully exchangeable. Wherever you are, wherever they are, they can have access to all of this data on you. And they want you, and they want these companies to attach your data into that system. So rather than just every time you go to the doctor's office and you give a certain amount of data, or the scribe is sitting there typing in every word that you say, and I do encourage people to tell the doctor to tell the scribe to go away. And then to make sure if there's a virtual scribe, to shut it off, right?
Mm.
So you can actually have a private conversation. If the doctor thinks something is really important, the doctor will write down whatever that thing is that's really important, or they'll keep a note on that. But anyway, I think that they want all of this data everywhere because they're creating a profile of you. And the biggest health the biggest electronic health record system is called Epic. It's really the biggest in the country. And the owner of that, I have the quote in my book, but the owner of that, so that I'm paraphrasing here, is they don't want to just know whatever you come in with to the doctor's office. She said something like, we want to know what you eat and when you go to sleep and how many hours you sleep and all of this kind of thing, because she wants it not to be an electronic health record. She wants it to be a CHR, a comprehensive health record, not just a EHR, electronic health record. So she wants the whole kit and caboodle of your life in their records, fully exchangeable. She has actually she doesn't like to exchange it as much as some do. But the government in creating this wants it fully exchangeable.
So I'm going to be devil's advocate for a second because, again, like I said at the beginning, I can see the benefit of data. So I have no idea what vaccines and things I had as a kid. So it would be nice for the doctor, no matter where I go or where I go, if I can just pull it up on my phone, to show me all of my medical records throughout the years. Also, I think it's beneficial because right now, like HHS has had a hard time studying autism because every state is its own incubator. Every state has their own HHS. They all report their numbers differently. So being able to actually study across the board, across the country, you need the data to be able to talk to each other. I even think about this like I kind of want to add up how many donations happen from the local level all the way to the top, like Democrat, Republican donors, stuff like that, because we only have access to like federal elections to see how much Democrats and Republicans spend on elections. But if you want to get the full picture, well, all of those databases are separate. So you would have to go to each county and each state and like add up all the donations. And it's just, I mean, that would take so much time. So again, from a data person, I'm like, okay, it would be nice if all of this talked to each other because then we could do studies a lot more efficiently and effectively, get answers a lot faster. And again, from my personal standpoint, it would be nice if I could just pull up and not have to, every time you go to the doctor and have to list out, yes, this happened, this happened, this happened. And I could just, here you go, So do you think that's worth it? Is that the good? With the bad we should take, or is just the bad outweighing that good?
Well, I think, the premise of your question and your statements is that, for the greater good or the public good, right? But that doesn't really exist. I mean, that's like an excuse that you or I would necessarily agree to what the greater good is. So the greater good for some people could be that you should feel comfortable at your doctor's office to say whatever you want to say so that you can get the help that you need. And others would say, well, we should have access to everything that happens in the exam room because then we could do better research about all of these different things. But, in a country that is free and that has a constitution that gives you individual rights, the idea that other people could say about your life or your rights that those have to go away because there is a greater good that somebody has decided. Like if you decided that that was a greater good and you could just enforce it across the entire country, when a whole bunch of other people would be saying, actually, Anna, I don't think that's a greater good. And I don't
Yeah,
like your version of a greater good. And you don't get to
that's
decide in
true.
this country. You don't get to decide. And so if somebody wants to come up with something and do the work that it takes to get people to come alongside them to do the research, of whatever that was, or if somebody wants to build a vaccine registration private here, you come in with your data, enter it once, and then you'll always be able to access this as an app, and you decide that you're going to do that. Whereas other people will say, yeah, I don't want that ever on an electronic system because I don't ever want the government or anybody else to ever go in there and be able to, if we get a bad government, right?
Hmm.
A nefarious government. I just don't even want it to be electronic in any way, shape, or form. So I think, that's the beauty of this country is that we as individuals get to decide, but we have to do the hard work. Just letting the government do these things and decide for us and take away our rights in the process and give us bad medicine
Yeah.
and and give all our data to people who may not have good objectives according to us. Each of us
Hmm.
individually might not agree with some of those objectives. I think
It definitely
it's
needs to
not good.
be optional, if anything. It should never be forced on someone.
Right.
Definitely agree with that. And I mean, just like you're saying, like that's a really good point. Like the power is whoever is holding that data. And
Mhm.
just like, I mean, it reminds me of like during COVID when they censored misinformation. And it's like, okay, who gets to decide what information
Right.
is true and what's false? And
Hmm.
as we saw, they were censoring, the government was censoring information
Hmm.
that was actually true,
Right.
that actually could have helped end the pandemic long before it actually ended. So we saw how dangerous this was. And yeah, now that you put that into perspective, it's like, yeah, like whoever holds that data has the power. And
Right.
like data is the new gold.
It is. It is.
Yeah.
Yeah,
So
and
you
we
also,
saw how many lives were lost because people who
mhm,
had the power, who had the positions, who had data that they claimed was true, like the really ridiculous ivermectin
yeah.
studies that doctors and other researchers would point out all the flaws and all the things that they did, cutoffs that were early or cutoffs that were wrong, and they'd stop the data collection and then they'd only give this, right? Just you can't necessarily even trust that the research will be right. It's who holds the data, who has the objective, what is their goal to make this data say, and ultimately, is this just for the money and the grants and the prestige? And no matter what it says, they don't care as long as they get more grant money for the next grant, right?
Yeah. Yeah. And so you also talk about the insurance side of things. So you
Hmm.
talk about like Medicare, the Affordable Care Act. So what do we need to know with those?
I think with Medicare, I would like now because we are into Medicare annual enrollment. It's going to begin on October 15th. I don't know who your listeners are, but whether they're young, middle age, or old, they know people who are having to make Medicare decisions or who are in Medicare and having a really tough time of it. And so I think I'd like to just talk about Medicare for a moment. To
Hmm.
just say that it's not the way people usually think about it, but it's the way I think about it. At age 65, you have no choice. Your money is no longer good to buy private insurance. You have no choice. The government forces you into Medicare. Now, you may have some residual insurance from your employment, or you still may be working, so you may be able to stay out of it for a while. But the second you quit working, you've got 8 months to get into Medicare, or you will start being penalized unless you stay out forever. And
You
so
get penalized for not signing up for Medicare?
Yes. The
I didn't
first
know that.
penalty that you will receive is that, and this is what the Clintons did, no law, no rule, they just wrote it in an operations manual, that if you don't sign up for Medicare, you will not get your Social Security benefits. Again, no law, no rule.
What?
Yep.
Where
And
are the lawsuits over that? Like, that's crazy.
there was a lawsuit and a really bad decision by now Supreme Court Justice Kavanaugh, who
Mm.
said you cannot unentitle yourself from Medicare, but these people were just trying to unenroll from Medicare. Just like, someday if we needed Medicaid, like, we were just like down on our luck, we couldn't get a job, whatever, right? You are not forced into Medicaid. It's there.
Mhm.
You could go in if you want to. You don't have to. You can go out, but not Medicare. Medicare, if you don't go in because of what the Clintons did, you can't get your Social Security, but it's even worse than that. Let's just say you're in Medicare and you have figured out that Medicare is running out of money in 8 years, running out of money. And you've realized that the rationing has just been ratcheted up. And there are things that you should have that would really save your life, help your life, improve your life, whatever, right? And you think, okay, I've got secondary insurance with my company. It's never quit covering me. I'm just going to get out of Medicare and just stick with my secondary insurance. Well, whether the secondary insurance would actually cover you or not is a big question. But the second thing is that the other thing the Clintons did was they said, if you leave Medicare, you've been in for a while, you leave. Then according to what they wrote, you have to pay back every dime you have received from Medicare and Social Security.
Oh my
Again, not a
gosh.
law, not a rule that ever got public comment,
I can't
nothing.
believe I've never heard of this. Like, this is insane. Like,
It
again, talking
is.
about like we're in a free country. How free are we? Holy crap.
Yeah. And the fact that you don't have a choice when you're 65 to buy other insurance
Yeah.
is really age discrimination. And people
Mhm.
need to start looking at it like this. There's going to be 80 million people in Medicare, and it is running out of money. And so they are trying to push everybody into the health plan version, which is Medicare Advantage, so that the
Yeah.
health plans can ration the care. And the health plans are rationing the care in Medicare Advantage because there have been 3 federal reports talking about how they are rationing care. They're denying. And then if you have the wherewithal and you are well enough or you've got somebody on your side, then you can appeal. No small deal to appeal, but you can
Mm.
appeal. And 75% of the time, they will withdraw the denial and let you get the care. But only 1% of people denied ever appeal. So
Wow.
this is an enormously lucrative strategy to deny on the part of the health plans and just keep all
Mhm.
that money. So I will
Yeah.
just tell you that we have a Medicare how-to guide to help people make decisions so they don't get trapped, so they don't get penalized. And then we also have a bill in Congress called the Retirement Freedom Act. And Senator Ted Cruz just reintroduced it 3 weeks ago. And
Nice.
Gary Palmer in Alabama introduced it in April. So now we can go get co-sponsors and hopefully get it to the president's desk. They
Yeah.
should love it. Just the idea that you could opt out of Medicare and not lose your Social Security. That's all it does. But it's so
Wow.
controversial.
Seems so simple. This is actually really interesting. I think you'll like this. So I went to my congresswoman's town hall a few years ago,
Mhm.
and I was the youngest one there. I always am at these political events, but so it was like mainly retirement age people, and I was so shocked because the number one complaint when someone said this, the room erupted. Someone
Well,
said, you need to do something about these scam callers. And the
mm,
entire room was like, oh my gosh, yes, I get it all day. I get like 10 calls a day. And like they're like the whole room was so loud over this.
yes.
And turns out it's something with Medicare. When you
Hmm.
enroll in Medicare, your phone number gets leaked and all these people are calling you. So, right there, like, do you know anything? Have you heard this before? Like, because I'm
This,
sure it's like that data thing. Like, your data
yeah,
just gets out there and it's just a free for all.
yeah. So I think there are 2 different types of calls. There are those who want to commit fraud using you. Like they'll say, "Hey, we know that you've got XYZ diagnosis, and so here's this wonderful piece of equipment. We can order it through Medicare for you." Right? And so there's these kind of scams. And then you participate in that scam because you think you're going to get something great. And you either get nothing or you get some little nothing burger, right?
Mhm.
But they've gotten a ton of money from Medicare for getting you that little thing. But the other thing is all the different Medicare Advantage companies that want you to switch to them. And really, you know, in our Medicare guide, we talk about many things. We talk about the 10 traps to avoid. We have every definition probably that you could ever think of if you're trying to figure out what is Medicare trying to say to me. But then we also just tell you about Medicare Advantage and why we recommend that everyone get into original Medicare. Now, the problem with the current administration is that they have brought Dr. Oz in as the head of Medicare and CMS, the Centers for Medicare and Medicaid Services. And we wrote a letter to President Trump and said, don't do this. Don't do this. And he wrote an article with the head of a health plan in 2020 when everybody was still really locked in. And he said Medicare Advantage is the answer to healthcare in America. And so he was writing it with a health plan, and Medicare Advantage is the health plan version of Medicare. And so he was saying that everybody except the Medicaid population should be essentially 20%, there should be a 20% tax on everyone to pay for this system, and then put everybody into a health plan, into Medicare Advantage. This was what he was promoting. And so now, starting on January 1st, with him in charge, they are bringing the rationing of Medicare Advantage into original Medicare in 6 states. They've got a list of services. They're going to have a company that will be paid according to how successful they are in denying access to care and finding medically unnecessary care, right? You define medically unnecessary.
Wow.
Right? And so this is Dr. Oz at work. And I've never thought that President Trump was good with healthcare. I think, you know, he's made a lot of bad decisions, including, you know, Operation Warp Speed, right, to get the vaccines and believing the vaccines were good and letting Fauci continue to talk over him at the podium. And you know, he's never, I wish he were, but he's never been good on healthcare. And the people that he picks are typically not well either, not good either. And so
yeah, I know that there's been a lot of people are very negative towards Dr. Oz, and I've just been cautious about it. I just look into a lot of stuff and kind of see how it goes because, you know, I didn't know that.
Yeah.
But a lot of times with these cabinet picks and all that, I say, well, they've never been in that position before, so we don't really have something to compare it to. So let them get in there and we'll kind of see how things go. And my criticisms of him are really just of the administration as a whole. Like I said, them partnering with big tech about this stuff and everything. There are some things like that don't make sense to me, but yeah, I didn't know that. So I was always wondering, I'm like, why is he out of anyone for Medicare and stuff? So that makes sense, unfortunately. Oh man. So let's talk real quick too about the Affordable Cares Act. They are what's going on? They're trying while we're recording this right now, the government shut down and they're talking about trying to change that. Democrats want to change it a little bit. Republicans don't want to. You are saying that we can expect a huge increase soon. So what's all that about?
So, you know, I guess it depends on where your listeners want to be, right? And so the Affordable Care Act was really meant to bring the entire country into socialized medicine.
Yeah.
It prohibits access to catastrophic coverage for anyone over the age of 29. So catastrophic coverage is affordable, like it's really affordable. And, you know, I have examples like, somebody in their 30s who was paying like $30 a month for affordable coverage because it was only for catastrophic and insurable events. So everything else is paid cash. And then all those prices come down to the cash level because everybody's paying cash. And now they're being competitive. Well, where are we going to go to get the care, right?
Yeah.
And so it's only there in a drawer somewhere for when you have a true catastrophe. And that is very affordable because very few people actually have true catastrophes. So anyway, so you have to understand that the Affordable Care Act took away real insurance, mandated coverage for pre-existing conditions, which is like telling your homeowner's policy that when the house is burning down, you still have to give them an insurance policy. So it really took away insurance, period. It's just become a third-party mechanism for paying. Um, and then because it consolidated the entire industry just into health plans, and it mandated the electronic health record earlier, right? Everything has been consolidated. And when Obamacare passed, it was considered a $1 trillion windfall to the health plans over just the first 10 years, right? And we're now beyond the first 10 years, and it's still a windfall. So this is like, we're not fully in socialized medicine because there's still healthcare sharing on the outside. There's still employer sponsored coverage on the outside, but usually it's being run by those very health plans for those employers. So we're really, really close. And then the health plans are really the corporate version of socialized medicine, right? They control the doctors, the data, the decisions, and the dollars. So people think we're in a free market situation. They think that the health plans are like the private industry. It's not. It's a government favored position. It's just like a public utility almost. So now when you look at what is happening during the shutdown, is that during COVID, the Democrats took the opportunity really to expand Medicaid to the middle class. And they want to keep it there because they want Medicaid expanded to the upper class. They want Medicaid for all. That's what they really want. And they will take the whole Medicare situation, pour that in too. And then they can just ration care over the entire population, and you'll never know the difference because everybody's just getting health care through Medicaid and nobody knows what's happening.
Okay, but there's people listening right now that are saying that's a good thing. They're saying we want socialized healthcare. Healthcare is a right. We all need it. And we need to fight against, the big health insurance companies.
Okay. So let's talk about
that.
So it's interesting when people want socialized medicine because all they want is coverage. That's all they want. They don't want access to care. They think they want access to care, but now it's not the health plan that they can sue. Now it's the government with police power that they cannot sue. They cannot get the care that they want because the government has decided who gets what care and who does not, and who will get access to euthanasia. That's what's happening in these government Medicaid systems. They're saying we can't give you that care, but we'll let you kill yourself, and we'll even give you the pills to do it, right? Because we've decided the care that you need, the care that you want to live, we don't think is medically necessary for you. So it's okay. You can just go get rid of yourself or just live your life without the care that we, the government, have decided that you don't need. And so people have like the wrong idea of socialized medicine, and they don't understand that it's worse than the health plan. Now it's people in power, in government, who you can't get rid of and you can't sue. And they're deciding who will get care and who will not. And if you're productive, if you're working, you're going to get access to care because they need you to keep bringing the taxes in, right? They need your money to continue to fund the system. But if you're old, too young, too disabled, too expensive, they're going to decide there are things that you don't need. And like some of the countries like Iceland, they just get rid of all the Downs babies. They make sure that all the mamas are checked, post-conception to see if you've got Downs, and they just get rid of the pregnancy. So they have virtually no Downs babies in Iceland because they don't want to take care of them.
Wow.
Right. So people who want socialized medicine, they also think they have a right to healthcare. Well, now, really? I wonder what their profession is. What if we had a right to their profession? Do they have a right to not work at their profession? Like, do you really have the right to the skills of a doctor? Is the doctor your property? Is the doctor a state doctor? You want a state doctor now? If you have a right to the doctor, you have a right to the hospital. They have no right. Does a doctor have a right to get out of being a doctor? Or no, we've got a state doctor and they're told you will practice for 50 years and there you go. We don't care what you do to these patients as long as you don't spend more money out of our global budget, and we will decide how big that budget will be. So people who don't understand this, they do not realize that people in Canada, practitioners in Canada, when their money runs out, so every year they get a bucket of money, and the province distributes it amongst the doctors and the chiropractors and all of these, right? So when their money runs out, which is usually after about 7 to 8 months, they go to Florida and Tennessee and Texas and Arizona, and they have clinics set up and they take care of people down there. And they leave all their patients in Canada, unless and there are plenty of Canadians that come down to America to get the care that they need on a timely basis.
Mm-hmm.
You know, and in Canada, you got a cancer. Oh, okay. Well, get yourself an appointment in like 12 weeks, and maybe then you maybe get to see the x-ray in some months after that, and then maybe you'll get to see an oncologist, and by that time your tumor has become grade 3 or grade 4, right? And so really, do you really want socialized medicine?
See, I used to want it because I don't think we actually have a true free market
We don't.
with health insurance right now because like, you work for an employer, they typically only offer one plan. You have to purchase that insurance. And then how many doctors are actually in network
Right.
around you? Maybe just one. So you're
Right.
basically forced to go to this one doctor. That's not a free market.
No.
So in my mind, I thought socialist, universal healthcare, even if we have to pay for it, I think would be good because then you would have options to all doctors. But the more I think about it, everything our government touches breaks. So I just don't trust our government to run anything. And to be honest, and I have said in the past, okay, we just don't have to model it after Canada because theirs is a failed system. But what about if we model it against with successful countries like Italy? They have kind of like a basic, kind of like how our Medicare is, where you have a basic plan that's free and you can pay extra for, better care or whatever. So I'm like, let's just do that. But again, like everything our government touches breaks. And if you think, I was just talking to a veteran about this. If you think about a true universal plan where the government runs it, you would actually compare it to the VA. And I don't think there's any person ever that has said that the VA medical care is good.
Right.
So if you think the VA is good, then yeah, you might think, the socialist healthcare is good, but it's terrible. And that could be replicated across the whole country if we go this route.
No, we are not going to go that route. Just saying. So I'm going to say that the solution to healthcare is what we call the 3C solution, and that is cash, catastrophic coverage, and charity. And charity is so much less expensive, and it's only to those who actually need care than we have it today with Medicaid, where we pay these health plans per member per month, even if they never ever come in to see a doctor. These health plans, this is their cash cow between Medicare Advantage and managed care Medicaid, where they get a per member per month payment from the government, and then they have the power to ration care. It's such a cash cow for them. Anyway, so cash means that for everything that is really small and minor and routine, you pay cash. And catastrophic coverage is for catastrophic and insurable events only. Now, everything now, because of those two things, will come down to an entirely different price structure, because catastrophic coverage pays you. Doesn't pay your doctor, doesn't pay your hospital, pays you. And so that's an indemnity policy. So now all the cash, either the cash for routine or minor, is in your hands and you're paying it, or for catastrophic coverage, it's in your hands and you're picking the doctor, you're picking the hospital, you're picking the medications. And we don't have all of these third parties taking money out of the healthcare system for utilization review, or just utilization review, or quality metrics, or all of these things where they're taking your data, they're taking money, they're taking everything, they're leaving you what's left. Now we just have a cash and a coverage system. And then we have charity. And I've had physicians tell me, I would just as soon give charity than Medicaid, because Medicaid, by the time I do all the paperwork to get Medicaid, it doesn't even pay the bills. And if your people would like a exquisite example, in Minnesota, we've got a program called Minnesota Care, and it's just like one notch up above Medicaid, and it's for certain people. And this one orthopedist did, there was a spinal surgery, and this one orthopedist extended the person's body in a 10-hour operation
Wow.
for under Minnesota Care payment. And how much money did he get paid from Minnesota Care for this 10-hour operation? The suite, the operation suite, his staff, everybody that was in there helping with this operation, making sure that she didn't bleed to death and everything, all the sponges were counted and anesthesia worked, right? Yeah. Minnesota Care paid total $1,000.
Oh, lovely.
And as he said, he just used that to pay his PA.
Wow. That's crazy.
Yes. So this is the government healthcare at work. This is a government program, and this is what they pay, right? And so why would you think any doctors would want to stick around in socialized medicine? Why not go, somewhere else? And what you're really going to get today is you're going to get non-physicians, which is what the corporations are trying to move to, is non-physicians. You only get a PA or an NP, and I'm a nurse, but non-physicians. So they don't have the expertise of the physician, or you're going to get AI,
Yeah.
right? So the non-physicians can follow the computer protocols in your treatment, but it might not fit for you, and they might not even know, and they may not know the questions to ask you to actually get to the diagnosis, and they don't have, the 11 to 15 years of education. They've got like one or two more years than I do as a nurse. But that's where the corporations are moving, or they're moving to AI.
Yeah.
We'll let
And
artificial
AI is
intelligence.
terrible with
Terrible.
with studies and everything. Like AI is only as good as what you put into it, and it
Yeah.
can be helpful with some things. Like I
Yeah.
have it help me like spell and grammar check. But when it comes to like real research, it's terrible, especially in healthcare. Anytime you want to like talk to AI about health, it just grabs the big pharma talking points. It doesn't
Yeah.
do independent thinking, I guess.
Yeah.
So it's
Yeah.
terrible.
Yeah. Yeah. And I think that people don't know this, and very much like Canada and Canadians, they say they've got an excellent healthcare system. Yeah. But as soon as they get something serious, they travel. They've got an actual
Yeah.
business called Timely Medical Alternatives that a guy started to help people get to other countries where they could get the surgery right away.
Wow.
And so, people aren't thinking. They're not really thinking this through. And what you really want is cash catastrophic coverage and then charity. And all three of those have the word affordable attached to them. And
Yep.
when all the prices come down to cash, I'll give you one other example of that, is the Surgery Center of Oklahoma. So Dr. Keith Smith, who I know, he searched the whole country to figure out which state to start this cash-based surgery center in. And he uses only paper records. So there's a huge amount of money he's not spending in the electronic system.
Yeah.
My book talks about all the money you have to spend that's different than paper and pen, right? Paper and pen chart. Anyway, so he started in Oklahoma. So the Surgery Center of Oklahoma, it's in Oklahoma City, and it charges 50 to 90% less than the hospital up the street. And even though the state tried to shut him down, the state is now telling all of their state employees, if you go get your surgery at the Surgery Center of Oklahoma, no copays, no deductibles, because the state wants to save money, right?
Yeah.
And on a LinkedIn post just probably about a few weeks ago, somebody was talking about being quoted $136,000 through getting it through employer-sponsored coverage, right? And he commented back, for that surgery, we would charge you cash $17,600 and I don't know, $84 or
That's
something.
so funny.
Yeah.
See, and like I'm a prime example. Like I am barely sick. I go to the doctor maybe once a year. I get
Mm-hmm.
sick maybe once every 4 years.
Mm-hmm.
So I go really the only doctor I go to is my OB yearly.
Mm-hmm.
And I mean my through my husband's work, it would be a $10,000 deductible and it's like 500 a month for me to have insurance. So we're not doing that. And I've said, okay, urgent care is $75.
Hmm.
So I might as well just pay cash. Like
Yes.
that's
Right.
crazy.
Right.
So yeah, I mean, I definitely hear you. I didn't even think about just getting insurance for the catastrophic coverage. So I'm going to have to look into that because that's what everyone says. Cause I've posted before. I'm like, well, if you want to save money on healthcare, just don't have insurance. And people are like, okay, well, that's how people go bankrupt though, because you have one car accident and that puts you out and you'll have to go bankrupt. You can't afford it. So there you go. That's a perfect solution.
But I do have to say that the Affordable Care Act said you cannot have catastrophic coverage over the age of 29. So it took it away because it wants the corporate version of socialized medicine for everyone, which is the health plan. That's what it said. You all have to, everybody has to have it, unless you are uninsured and choose to pay the penalty, which is now gone, or
Yeah.
if you go into medical sharing. So the healthcare sharing organizations do coverage for far less than health insurance. And so we do have to get back to what you're saying. And so we have a bill called, it's not yet been introduced, but it's called Make Health Insurance Real Again. To get rid of that prohibition that is in the Affordable Care Act that says we
Yeah.
cannot have real health insurance. And the other thing, when you're looking at cash, we started a directory of cash based doctors. They don't take insurance and they don't take government. And
Hmm.
it's called the Wedge of Health Freedom because it's a wedge of care into which doctors and patients can escape when the government and the health plans say no. So we called it the Wedge of Health Freedom. And your listeners, your viewers can go to jointhewedge.com and see if they can find a doctor in their area, a doctor who will actually work for them, spend time with them, not be sitting there in the chart trying
Yep.
to, check every little thing and dot every little thing, right?
Yep.
And that's all by cash. So,
Nice. Yeah, and every time I've talked to someone who goes to a doctor where it's just cash, they've raved about it that you go
mhm.
in and you actually spend like an hour and a half with the doctor instead of 5 minutes.
Yep.
So it's great.
Yeah.
So that's awesome. Is there anything else? So you've given us a lot of information as we've kind of gone along, different bills to advocate for and to reach out to elected officials. Is there any other like action item you want to tell us to do?
Yeah. So I'll just tell you two really quick little things. Go to our website, cchfreedom.org, and go to our helpful handouts, which is right on the homepage, sort of at the bottom, and find the organ donation refusal card. A lot of people don't understand that your organs can be taken without your consent if you haven't signed a refusal or there's nobody to talk for you. And so what HHS is finding out now is that how quickly they're deciding that somebody is futile and
Yep.
then, just taking their organs, right? When some doctors have stopped these processes and the person has woken up and is functioning today, right? So you
Mhm.
want to protect yourself, and not having it on your driver's license is not enough protection. And the other thing is, for anybody who's got a baby or thinking about having a baby, there are states that collect the DNA of children without parents knowing it. And so people can go to itsmydna.org, and we could certainly have another whole conversation about that. But I just
Yeah.
want people to know that that's happening in some states, and we have a list of who's doing it, and so you can find out how long your state keeps the DNA of your children
Mhm. Yeah, I
and
remember
sells it, uses
that
it.
went viral not too long ago, that was happening. So, oh man. And then there's a lot of talk recently too about how the hospital takes the placenta for the stem cells and sells it,
Yes,
but they don't, but you are not allowed to take your placenta and sell it.
right. Yes, I know.
So many crazy things happening.
Yeah.
But I'm glad that we're talking about these things.
Mhm.
Um, so I like to ask everyone if there was one thing you wish people knew, what would be that one thing?
I guess what I wish that they would know is that doctors and probably want to be working for them, but the entire healthcare system is not working for them. So what they need to understand is they have to protect themselves in the exam room today, and they have to protect themselves and their freedom in this country. And so, take a look at the information on our website, which is meant to help you protect yourself against coercion in the exam room and to give you truth and protect yourself against coercion in Medicare decisions, but also to stop the Real ID. We need everybody in this country to understand what Real ID is and to put their best foot forward to stop it and to tell people what it really is.
Yes. Awesome. Thank you so much. You've already given your website and everything, but is there anywhere else that people can find you?
They can find me on Twitter. So just my name on Twitter, and they can find the organization in Facebook, and we're hopefully going to be starting some other things in the future, like podcasts and Substack, but that hasn't really started yet. So.
Awesome. Okay. Well, thank you so much for coming on the show. This was very informative, and I'm sure we could have took an hour on each topic, but we kind of hit a lot today.
Yeah.
But yeah, we'll have to talk about the baby DNA sometime. But thank you so much for
Thanks,
coming
Amy.
on. Thank you.
I really
And I will
appreciate
see
it.
you guys all next time.